The liver is a really important organ in the body, and no one's going to deny that. Very interesting organ, capable of self-regeneration, and has a number of important functions. You could split these into some of the metabolic functions, that's detoxifying things, removing medications from the body, and also synthetic function. So it produces certain proteins that are really important in our body's function. It can become irritated and potentially damaged, both through infection, inflammation, but also through toxins, because of the fact it has the function of breaking down toxic products and making them safe for removal either in our urine or into our stool. So I'm going to talk today about the liver function test. We're going to stick to a relatively small number of liver function tests. I'll explain what they are and what you might see and why you might see that. So a lot of the liver function tests are actually testing for enzymes, and these are enzymes that are typically found inside of the liver cell, and they may be leaked out in a small amount related to a healthy bodily function. But if you see large amounts coming out of the cells, it could suggest that the cells themselves are irritated. We're going to start with the ALT and the AST. These are alanine aminotransferase and aspartate aminotransferase. It's just a long name for the enzyme. If you see that these are leaking out in large quantities, one of the causes could be irritation of the liver cells. And we call this a sort of intrahepatic problem. So liver function tests can be looking at, is there a problem inside the liver cells? We also have the second part, which I'll come on to, which is obstructive pattern, because the liver produces bile, which helps us digest. But if that gets blocked, we sometimes see an obstructive pattern. With this type of enzyme release, it usually suggests that something's going wrong inside the liver. So high levels can be found because you've acquired an infection in the liver. So for example, hepatitis virus infection. If you've had an overdose or a poisoning of the liver by medication like paracetamol, or maybe some of the drugs that we use in rheumatology like methotrexate, the levels may go high. Low levels are less common. We don't tend to see them that often, sometimes with some nutrient and vitamin deficiencies. If you have a really advanced end-stage liver disease where there's not that many liver cells left, you may not be leaking the normal amount of liver enzymes. So we mainly get concerned about high levels and not about low levels. Now, clinicians might do some more technical stuff. They might look at the ratio ALT to AST. It's beyond the scope of this video. Most important thing is, if those levels are high, you might want to look at liver viruses, you might want to scan the liver, you may need to see a hepatologist. They are enzymes that are very similar to enzymes that are found in muscle tissue. So it's not always that a high level of ALT and AST is because the liver's upset. Sometimes muscle inflammatory conditions that a rheumatologist deals with, like myositis, dermatomyositis, they can leak out similar enzymes. And sometimes people with myositis are first referred to a liver specialist because we thought inadvertently that actually the liver was the problem. It wasn't, it was muscle inflammatory condition. Now, you can do specialized subtests called isoenzymes to try and help. But again, the key message is, I think, ALT, AST, investigate inside the liver, look for viruses. So the next two types are so-called obstructive picture. And that's an alkaline phosphatase, or ALP shortened, and the gamma-glutyl transferase, or the GGT. We usually see this when the liver's upset because it's unable to remove the bile that it's producing as part of its function. So the production of bile goes into the gut, and it helps to emulsify fats. It helps to make big globs of fat into tiny little balls of fat that are much easier for us to digest. If that area becomes blocked, then there's a back pressure on the liver, and the back pressure on the liver can start to irritate the liver, and we can detect this with these tests. What could cause that? Well, stones, bile stones is the most common cause. More serious causes like cancer in the pancreas or bile duct, or inflammatory conditions that are narrowing the exiting tubes of the bile ducts could be a cause. Gamma GT is also something that is associated with more alcohol use. So we do see a higher gamma GT in people who drink a bit more alcohol. Low levels can happen in some very rare conditions, vitamin deficiencies and rare congenital things for alkaline phosphatase. Again, there are some problems with these tests. Alkaline phosphatase from the liver is very similar to alkaline phosphatase from the bone. And conditions of the bone like Paget's disease and osteomalacia and other conditions may cause derangements in your alkaline phosphatase levels. And just like with the ALT and AST, you can do isoenzymes, but what you probably do is try to interpret the ALP rise in the overall picture of this person's liver function tests. The final liver function test for the obstructive picture is the bilirubin itself. So that is the actual component of the bile. Bilirubin is made from breakdown of your red cells. If you're making plenty of bile, but it's being obstructed, you may see a high level of bilirubin. But because it comes from the red cells, there are other sources. So the bilirubin that we find in our bile is so-called conjugated. It's just the type of bilirubin that the liver makes. But if you had a lot of breakdown of red cells, you will see another type of bile that's called unconjugated bilirubin. It's not usually low, it's usually high. First thought is obstruction. There are some benign conditions like Gilbert syndrome, and then if you're having a lot of red cells being burst, releasing the hemoglobin, which can then be broken down into unconjugated bilirubin, so autoimmune complaints where your red cells are being attacked and burst. Autoimmune anemias can sometimes cause a high bilirubin. Final liver function test before a kind of surrogate test for the liver is your albumin. So the albumin is a really key protein in the blood. I think of it as the blood's delivery driver. It can attach a load of drugs, it can deliver them to different places, and lots of things are bound to albumin. And if you are malnourished, your liver is struggling to produce albumin, so it can go low if you're malnourished. It can go low if you're losing protein from somewhere else. You might be losing it through the gut, or you might be losing a lot of protein through the kidneys. So we tend to be concerned mainly about low albumin other than high albumin. High albumin is not so commonly seen. Maybe if you're dehydrated, the albumin may look abnormal. So the last part of liver function test is another part of the synthetic function. So the enzyme test is AST, ALT is inside the liver, hepatic picture. The gamma GT, 8-LP, and the bilirubin is obstructive picture. The albumin is synthesized in the liver, so we could call that part of the synthetic, part of the manufacturing test. The other thing that the liver does is make clotting factors. And one of the tests of clotting, called the prothrombin time, or PT, is another way of saying how is the liver functioning. Because if the liver's struggling to synthesize its key products, it can influence the rate at which your blood can clot and lead you vulnerable to bleeding disorders. And the prothrombin time is the one we watch out for. That can be influenced by blood thinners, of course, most notoriously warfarin, which is where you tend to monitor the PT time, the prothrombin time. But in advanced liver disease, you may see changes in the PT function. So basically, liver function is a series of enzymes. You check also the bilirubin, which is a product that goes into bile, and you check the albumin, which is a protein made. And you might want to check the clotting if you're particularly concerned. And we separate that into intrahepatic problems with the enzymes, usually things like hepatitis, obstructive things, usually things like gallstones, and synthetic problems, which is more advanced liver disease. I hope this video has helped break down those acronyms and make a bit more sense of your liver function tests. If you've got further questions, drop me something in the comments below. If you've enjoyed the video or you found it helpful, share it or give it a like to help with the channel's visibility. Thank you.